Hello, my name is Audra Kessler, and I am a doc student in the Health Science and Exercise Leadership program at Penn West University. This will be my Teaching Artifact 1 presentation. It is on educating future healthcare professionals, building competency and communication for diverse patient encounters with visual impairments. My overall portfolio topic is Bridging the Gaps, Empowering Healthcare Professionals to Care for Special Populations. My vision statement focuses on empowering these healthcare professionals to care for special populations. My mission statement is to empower healthcare professionals to address the unique challenges faced by these populations through evidence-based curricula, clinical experiences, and community engagement. For this presentation and my Teaching Artifact 1, I will be focusing on my research foci 1, which is enhancing student competency and communication skills in navigating diverse patient encounters. For my teaching presentation, I will be participating in an event called Next Generation Healthcare that's hosted by Slippery Rock University. The university invites local high school students to come and learn about the healthcare professions. So for this event, students get to choose up to 4 30-minute learning lab sessions in different areas of medicine. Some of these include physician assistant, occupational therapy, physical therapy, athletic training, and a representative from these departments come and teach the students about their professions and some of the common things that they encounter regarding their patients in these professions. So I will be representing the physician assistant program, and I will be specifically talking about special populations. And one of the populations that I will be focusing on are those with visual impairments. This artifact will consist of a presentation followed by a learning lab. I also created a poster for the students to view. My objectives for this teaching presentation are to identify common healthcare challenges faced by patients with visual impairments, particularly within vulnerable and special populations, analyze healthcare disparities experienced by individuals with visual impairments and their impact on access, quality, and outcomes of care, experience visual impairment firsthand to increase empathy by wearing simulation goggles and performing tasks, and evaluate personal competency and communication effectiveness through reflection and feedback. Healthcare disparities significantly affect individuals belonging to special populations. They often experience unequal access to medical services, which can result in poorer healthcare outcomes. Medical providers play a critical role in delivering care to these underserved groups. However, they too can encounter challenges that hinder the continuity and quality of care. These obstacles may include gaps in education, ineffective communication, implicit biases, and limited experience with these populations. It's important that we address these barriers by integrating care for special populations into medical education. This will help future healthcare providers be better equipped to deliver comprehensive, culturally competent care. For this presentation, I will be focusing on special populations of patients with visual impairments. Patients who have visual impairments can face many challenges when they're seeking healthcare. One of the biggest challenges they have is the insufficient availability of adapted information resources. So for example, when these patients are presenting to the office, if they have limited vision or are blind, they will have a very difficult time reading anything that is written. So any written instructions, if they have to confirm their personal information when they're checking in, they may also have difficulty reading medication labels, which could lead to them not taking medications appropriately. They may have difficulties filling out consent forms, or again, just reading any patient education that could be provided to them through brochures or posters. These individuals often also feel embarrassed because of their situation. They may be reluctant to share information or to share with the provider the extent to which their vision is impaired. So as a result, we see lack of transparency with these patients. We also see that they tend to avoid eye contact. These individuals can face a lack of accessible technology. These patients often communicate and access medical information using braille printers, speech-enabled computers, or speech-to-text translation devices. If these things are not present in the office or in the hospital, then that creates a huge communication barrier between the patient and the provider. These individuals can also have difficulty using medical devices or dosing specific drugs. So, for example, if a medical device has visual instructions, if someone is blind or has difficulty seeing, they may not be able to view these instructions appropriately to learn how to use the medical device. They also could have trouble taking medications with precise dosing. So, for example, if a patient has diabetes and they have to give themselves insulin, which requires drawing up a specific amount of insulin based on what your blood sugars are, if they can't see the lines on the syringes to see how much insulin they're drawing up, then they could harm themselves by not giving themselves enough insulin or giving themselves too much insulin. Patients with visual impairments also have challenges navigating their physical environment. This could include going up and down stairs, reading signs or following directions, accessing or using medical equipment, navigating crowds, or noise. So, what are some solutions to these healthcare challenges that this population faces? So one solution is going to be technology, making technology more available to both patients and providers. These can include mobile applications for screen readers and voice recognition or speech to text. This will help decrease the communication barrier between patients and providers and allow them to communicate more effectively. It's also important to adapt their physical environment, making it more conducive to moving around. So, tactile orientation maps for floors and stairs, using tactile markings on doors, creating things such as posters or directions that have a high color contrast, and utilizing auditory notification systems. Another big one is just making communication more accessible. So that involves using audio recordings or creating things or providing resources that are in Braille or making sign language interpreters more readily available. And then the last big solution is training healthcare professionals. So it's important that we're educating our healthcare professionals on the needs of these patients and how we can best communicate with them. So why are healthcare providers not receiving the appropriate knowledge and education on these specific topics? Well, the most significant barriers include the lack of time available in the curriculum for new content and inadequate resources. This demonstrates the challenges that medical programs face when trying to educate students on this topic. It also poses a concern for inadequate training of healthcare professionals. As part of my presentation, I wanted to review 3 visual impairments that are commonly encountered by physician assistants in medical practice. These include diabetic retinopathy, tunnel vision, and low vision. One of the most common visual impairments affecting patients in the United States is diabetic retinopathy, which is a complication of diabetes. So diabetes is a chronic condition that affects how your body uses glucose, which is a type of sugar, for energy. In the United States, there's approximately 38 million people that have diabetes, which accounts for about 11.5% of the patient population. So in 2021, there are approximately 9.6 million people living with diabetic retinopathy in the United States. Diabetic retinopathy is also the leading cause of blindness among working age U.S. adults. The picture on the right demonstrates the difference between a healthy eye and an eye with diabetic retinopathy. Diabetic retinopathy occurs as a complication of diabetes. Over time, too much sugar in the blood causes damage to the tiny blood vessels that nourish the retina, resulting in an inadequate blood supply. Blood vessel damage can result in hemorrhaging, where the blood vessels can burst, causing blood to leak into the eye. They can also try to grow new blood vessels, which could develop poorly. All of this damage leads to vision loss. Because diabetic retinopathy impacts a significant amount of the population, it is essential that medical providers are educated on this topic so that they can appropriately care for their patients. To improve student knowledge, programs should provide diabetes education, including information on its prevalence and how to understand hemoglobin A1C. Future healthcare providers should also be educated on many factors related to diabetic retinopathy care. These include screening measures, risk factors, patient education, maintenance care and follow-up, and treatment modalities. Another common visual impairment is tunnel vision. This is also known as peripheral vision loss because patients who experience this are unable to see anything in their periphery. They are only able to have their central vision intact. This can occur temporarily or it can be permanent. Some eye conditions where this is commonly seen are glaucoma, retinitis pigmentosa, diabetic retinopathy, retinal detachment, optic neuritis, and retinal vein occlusion. Other health conditions that can cause tunnel vision to occur are migraine headaches, carotid artery disease, strokes, concussions, and high blood pressure. Low vision is the last visual impairment that we will discuss. This occurs when patients have difficulty completing tasks such as reading, driving, recognizing people's faces, telling colors apart, or being able to see the TV or a computer screen clearly. The biggest distinction with low vision is that it cannot be corrected with glasses. Common causes are age-related macular degeneration, cataracts, diabetic retinopathy, and glaucoma. Treatment for low vision are going to be using brighter lights, using magnifying glasses or anti-glare, increasing contrast, and reading using larger text. It is also important to note our vulnerable patients within our special patient population. Individuals with visual impairments may also suffer from other medical conditions, creating even more barriers to their healthcare. It is critical for healthcare providers to be able to care for these patients and provide them with appropriate resources. Patients with HIV are 2.2 times more likely to have poor adherence to their antiretroviral therapy and 1.9 times more likely to avoid medical care. Patients with visual impairments have higher rates of depression and anxiety. Nearly 33% report having depressive symptoms. And breastfeeding women with visual impairments have more difficulty learning how to breastfeed, lack of access to information in non-visual formats, they have limited transportation options, and they may face unsupportive attitudes from healthcare providers. So what are some best practices when communicating with this population? So some of these include using an optimal language, introducing yourself every time you enter the room, telling the patient what you're going to do before you do it, and that includes before leaving the room. Patients who are blind or have difficulty seeing may not be able to recognize faces, so it's important that you're always introducing yourself so the patient knows your name and knows who you are and they know who they're speaking to. It's important to listen to the patient's caregiver, but only after gathering as much information as you can from the patient. So again, in these situations, it's important that you're addressing the patient and making the patient feel as though they are important and they are your primary focus. The caregiver can then provide any kind of supplemental information once you're done directly speaking to the patient. If available at your facility, you could offer if the patient would like to have a patient advocate. It's important to accommodate the needs of the patient, but not to over-focus on the visual impairment during the HPI. So for example, if a patient is coming in complaining of stomach pain, you want to make sure you're asking all of the specific questions related to the stomach pain because their visual impairment probably doesn't apply to this specific problem. Now, when you're talking about the medications that you may prescribe or labs or diagnostics that you may want to order, And then yes, you need to talk about the specific accommodations that they will need due to their visual impairment. But as far as the actual problem that they're coming in to talk about that day, you really only want to focus on their problem. It's important to place the patient in a quiet location. Again, as we discussed earlier, sometimes noise can be a physical barrier to them. You want to ensure the patient has access to mobility equipment. So if they use a cane or a guide dog or any other kind of mobility equipment, it's important that they have access to it, or if you remove it from them, that they're able to know exactly where you put it, so if they need to get that back. It's important to ensure that the patient has access to any personal technology. So if they're using their phone or smartwatch, to utilize any apps to help translate speech. You want to make sure that they still have access to those things. And then ensure the patient knows where the call light is, or they know how to note that they would need help or in an emergency, or how to gain the attention of a medical provider. So we discussed best practices for communication as a practicing healthcare provider, but how do we improve education for our future healthcare providers? Some of these strategies for curricular improvement are the presence of a faculty champion, so a faculty member who is invested on the topic, support from academic leadership, and partnering with community-based disability programs. Another strategy for curricular improvement is simulation. Simulation helps students learn to recognize the challenges of living with visual impairments and its impact on normal daily activities. Studies have shown that empathy increases when the individual is exposed to an actual experience. Students also reported increased understanding and awareness of patients and their clinical conditions through simulated experiences. Here is a picture of the poster that I created for the students to view during the Learning Lab. I used key information to highlight important concepts from my teaching presentation. The next part of my teaching presentation was a learning lab. In this lab, students had the opportunity to wear vision goggles that simulated the 3 visual impairments that I discussed in the presentation. These were diabetic retinopathy, tunnel vision, and low vision. The students participated in daily activities and tasks wearing the goggles, such as writing their names, tying their shoes, and reading a prescription. This simulation allowed students to experience some of the daily challenges faced by patients who are visually impaired. Once the teaching, presentation, and learning lab were completed, students were asked to scan a QR code which was linked to a 7-question survey that I created using Qualtrics. The survey consisted of 5 Likert-style questions ranging from strongly agree to strongly disagree. Feedback from the students was very positive. 100% of participants strongly agreed that the learning lab enhanced their understanding of the challenges faced by patients with visual impairments. 100% of participants also strongly agreed that this experience changed the way they think about caring with patients with disabilities. All participants agreed that they felt more confident in applying communication strategies. Students found the Learning Lab valuable because it allowed them to see challenges from a patient's perspective. The main suggestion for improvement was to increase the time of the session, which I definitely agreed with. Here are some pictures that were taken during the teaching presentation in the Learning Lab. The Next Generation Healthcare event was also featured in the Slippery Rock University News and the local newspaper, the Butler Eagle. These are my references.